why are we bothered about high risk pregnancy? So when there is a pre-existing medical condition, then definitely it affects the development of the baby. So pre-existing alcoholism or a high smoking condition, if the mother doesn't leave smoking or alcohol during the pregnancy time, definitely the formation of the baby is affected. So baby can be deformed, malformed, or sometimes there could be very low birth weight babies or intrauterine growth restricted babies. The blood flow from the mother to baby or the placental formation doesn't happen in such conditions, and hence it will definitely directly affect the baby's development and the growth of the baby. The other issues like pre-existing diabetes or pre-existing renal problem, kidney problem, or pre-existing high blood pressure definitely will affect the placentation and thereby affect the growth of the baby. The baby can have a intrauterine growth restriction. Sometimes miscarriages can happen, sometimes intrauterine demise can happen. The baby can die in the uterus if it is left being uncontrolled. These diseases are not being controlled during pregnancy. These damages can happen. Sometimes it could be pregnancy induced. When it is pregnancy induced, that is, the mother was fine before, but her lifestyle was bad, or she's been very obese even before pregnancy and she's continuing to gain a lot of weight during pregnancy also, then there are other complications like it could be large for gestation baby. The babies can grow bigger, or she can end up being a diabetic, thereby leading to high glycemic index for the baby, also leading to large for gestation. Sometimes the increase in glycemic level will also cause growth restriction to the baby, and sometimes it also can, uncontrolled diabetes can also cause intrauterine demise, that is death of the baby in the womb itself. So these are complications, that is, it can cause miscarriages, it can cause malformation, it can cause defective formation of the baby, and growth retardation, that is, baby can go unusually bigger. Sometimes baby will not grow much inside the womb. Sometimes the baby can die. Sometimes it can also lead to a preterm delivery. So all these are complications due to any of the high risk factors. So whenever we plan a pregnancy, it is better to be very careful if you already have a pre-existing medical disorder or pre-existing lifestyle disorders.